Dear friends, Namaste. I am Dr. Hemamalini Jayachandran, Principal, Nursing College, Vistas Periyapalayam Campus. Very happy to interact with you all. This is my first video to my viewers, my dear students, my dear staff nurses, and also the new mothers. Let us see the three important lifelines of breast milk, unlocking the secrets of colostrum, foam milk, and hind milk. The colostrum, as you all know, it produced in the first 4 days after the birth. Why I have given the symbol of golden colored drop? It is always called as golden drop. Tanga drops. It is also called as Tanga Sottukal. Okay, so it is high in immunoglobulin content and it is very good for the easy bowel movement for the baby, act as a natural laxative and rich in leukocytes and immune cells. It has got a rich of growth factors and high in protein concentration and lower fat and lactose. It is always called as it is the first milk, colostrum. Many people have the myth of it is a dirty milk since it is yellowish in color, but it is a life of the baby for the healthy of the baby. Let us see the second lifeline of the breast milk. It's a fore milk. With the name itself, we can understand the milk which comes first. It is produced at the beginning of the feeding. It has got a high in lactose, 7 grams per 100 ml. It maintains the infant hydration because water content is more and quenches the baby's thirst. It contains water soluble vitamin and less in lipid concentration. Hence, the fore milk is very important for the baby to maintain the hydration and it satisfies the needs of the baby. The second milk is the hind milk, which is you can understand from the word itself, it is there behind. When the mother feeds 30 minutes at one breast, the first 10 minutes, the milk which comes, it is fore milk. After that, the 20 minutes, the milk which comes hiding behind, that is called as hind milk, which comes later part of, that is end of the feeding. So, as we said, it is rich in polyunsaturated fatty acid and promotes fillingness, stomach fullness of baby, that is called satiety, and important for the adequate weight gain because high in energy, high in fat, so hence the weight of the baby will be increased and high concentration of fat soluble vitamin and fat will be more and energy density will be high. So from this we understand the mother, when she feeds 30 minutes in one breast continuously, the baby will get both the water milk and then fat milk, fore milk and also the hind milk. And this is the small sprinkle of insights. Any mother, they should start breastfeeding within 1 hour. If the mother is undergone normal delivery or cesarean section, that ensures the colostrum intake. And do not switch breast too early. The baby must reach hind milk along with the fore milk also. That's how the previous slide I insisted you all that we need to feed the baby the first 30 minutes continuously at one breast and after that you go for the other breast. The fore milk excess if you feed may cause lactose overload and hind milk deficiency causes the poor weight. The scenario, for example, if the mother feed the baby for 10 minutes in the left breast and if the baby goes for sleep, as you all know, baby will sleep most of the day, most of the time. And if the mother is not awakening the baby and if the mother is not making the baby to feed continuously, what happens? The first 10 minutes, water milk alone, fore milk alone, the baby consumes. Then the baby may not gain weight. And after some time, maybe 10 minutes or 15 minutes, the baby will wake up again, the baby will cry again because did not get much energy from the hind milk. So mother again will feed in the right breast. So again first 10 minutes, the water milk, the foremilk alone the baby will get. If it goes continuously, what happens? The baby will not get the hind milk. Automatically, the weight gain will not be adequate. So the parents will come to the clinician or come to the nurse or obstetrician with saying the baby did not gain weight at all. So please, my dear friends, my dear students and staff nurses and also the mothers, give the new mothers the knowledge, the sprinkle of insights regarding the foremilk, hind milk and also the colostrum. So as we all know, it is dynamic and not fixed. In summary, it is breast milk, we can say it's a 3.0, a different version from the colostrum, foremilk and hind milk. It is the golden drop, we can say. So let us unlock the secrets once again. The last summary point of view, the colostrum, we say it is the first vaccine. It is the first lifeline of the baby. It is the golden drop. It appears in within 4 days and it is appears thick and yellowish in color, volume small and concentrated. It has got a more of IgA, leukocytes, lactoferrin, vitamin A and growth factors. It is gives the immunity and gut maturation and prevents jaundice, and it has got a high in protein, low fat and low lactose. And foremilk, as you all know, it's the first feed, beginning of the feed. It appears thin, mild bluish, watery, and volume as such it is moderate and has got a more of lactose, water, vitamin B and vitamin C. It helps in hydration and gives quick energy and low in fat. It is around 60 kilocalorie per 100 ml. And when we come to the last fuel, that is hind milk, it is at the end of each feed, the baby will get it, and appearance is very thick and creamy, and volume will be moderate, and it has got a high fat and DHA, and then ARE, and then vitamin A, D, E, K. Function is got a it increases the weight gain and helps in the brain development and gives fullness for the baby. Then only the baby gets fullness and baby will set a clock that is called as demand feed. Every 2 hours the baby will call the mother for the feed. The baby will cry. With that, you can understand the baby is hunger. So every 2 hours, the baby will set a clock that is called as demand feed. If the mother is feeding only 10 minutes and then making the baby to sleep, what will happen? So baby will be hunger in every 15 minutes. And one more point I would like to say here to the new mother is, whenever the baby cry, it is not only because of hunger. Sometimes the baby would have passed urine, the baby would have passed motion, the nappy will be wet and it will be irritating the baby may cry. And second thing, some newcomer may come and see the baby and then touch the baby is not liking it. And third thing is, sometime in the bed some small ant may bite the baby. It's maybe because of that, or the relative who comes near, they have a cough and cold, and when they sneeze with the louder noise, the baby may cry. So new mothers, please understand, if the baby cry, it is not only because of the breast milk and hunger. It may be due to many reasons. You see that. So if you're very confident that you have fed both foremilk and hind milk, half an hour you have fed the baby, you are stimulating the baby and then feeding good. So damn sure baby is not crying for the milk alone. Okay, so we understood so far foremilk and hind milk, and before that we have seen the colostrum also. Okay, so clinical pearls, what I want to insist is, start the feed in 1 hour, allow baby to finish the one breast and allow the baby to get the hind milk to increase the weight as per the growth and development. And foremilk excess also should not be there, and hind milk deficiency also should not get, and the baby will see as a unsatisfied baby. So it is a memory trick for the understand and to have the memory, so you can remember as a CFH. Okay, it is colostrum and foam milk and hind milk. My dear viewers, if you have any doubt, you can come to my login ID and you always can ask. Thank you all.